Hey everybody, it's Joanne Voorhees Collins, aka Coach Collins here, coming at you this morning. I tried to have this be live, but the overlords that manage the platforms are not allowing me to do that. We've had multiple technical difficulties this morning. Nonetheless, here we are. I'm recording this right now. So for those of you who know me as Coach JJ, hi, welcome. Thank you for tuning in today. For those of you who don't know me, I'm Joe Collins, aka Coach JJ, and I am a public health educator. Used to be nurse, although that never stops once you have the training. And I am a board certified health and wellness coach. And today I wanted to talk to you guys about some very important research that has popped up. This is extraordinarily important. And it's important because for me, as a healthcare professional, I specialize in working with people that have type 2 diabetes. Centers for Disease Control had said previously that they had projected that 27-ish million people had current diagnosis of diabetes. They expect that 75 million more people are probably walking around with it and don't know that they have it yet. We now know that COVID itself causes diabetes. The problems with this are if you are overweight or obese, if you have a family history of people in your family, more than one person, having diabetes, or if you have cardiovascular stuff going on, high blood pressure, officially diagnosed with cardiovascular disease, all this stuff comes into play as far as this new research is concerned. And I don't know if you can see my screen right now, but the first study we're going to look at that was published apparently September 15th. I don't know why it's December and I'm just now hearing about this, but this first study, as you can see in the title of the study, hyperglycemia in acute COVID-19 is characterized by insulin resistance and adipose tissue infectivity by SARS-CoV-2. So I'm going to go through this research study and another one and break it down for you as to what it's actually saying. Because I'm all about the education part. I am not here. I'll just go ahead and make some disclaimers. I'm not a physician yet. I may one day be. That's in the future. But I'm not a physician. So I can't, diagnose you. I can't prescribe things for you. I am, however, public health educator, used to be a nurse, things like that. So I can talk to you about the information and tell you things to go back to your healthcare provider and ask. Okay? And so, in this case, we have information that's very, very important for everybody. And from this study shows that acute respiratory distress syndrome that is a part of COVID is also correlated with having high blood sugar. They are saying in this research study that insulin resistance is actually why people are having high blood sugar. They are also showing that in both patients and animals that have been infected with COVID have a decreased level of a very, very important hormone and chemical mediator that works with insulin and glucose uptake. They are also showing that the COVID virus itself has the capacity to infect fat cells. So if you have Dunlap syndrome, it's kind of a joke in the South where we call it Dunlap syndrome, where it's your belly Dunlapped over your belt. So if you have a larger midsection, or you just have general, kind of overweight sort of everywhere in your body, this is a thing that can possibly be happening to you. So let's go through this first research study here. And I'm going to go ahead and just point out the very important things that you all need to know. A lot of this is, clinical jargon and, descriptive terms and things, but let's look at the most important points. They talk about pancreatic beta cell failure, and hormones and things like that. The description here, the summary here, is written in, kind of like medical terms. Basically, they're saying we found that COVID infects fat tissue, and that this infection of the fat tissue is one of the main drivers of insulin resistance that therefore contributes to what I would call the diabetic state. And this is something that's going to be huge in terms of medicine, because at this point, diabetes is being looked at as a disease unto itself. And I have actually disagreed with that philosophy for a while now. I've been working specifically with diabetes patients for the last 3 years. And through my work with these people, and I've talked to thousands of people at this point, I don't think that it's a disease unto itself. It is a manifestation of additional underlying disease process, and we'll get into that further as we go along. So if you can see my screen here, it gives a picture of the adipose tissue. Adipose tissue is basically fat. It's all the jiggly wigglies in your midsection, on your thighs, and maybe on your arms too, and that kind of thing. The way this virus apparently works is that when it infects the fat tissue, it stops the production of adiponectin and leptin. Both of those hormones are absolutely critical to how your body handles incoming glucose. And so with the reduction in adiponectin and leptin, when you have incoming glucose, it doesn't know what to do with it. Therefore, the sugar sits there, and the sugar, in addition to the virus itself, creates condition of excessive inflammatory action, which creates all kinds of other chemicals that can cause joint pain, gastrointestinal problems, like nausea and inability to digest food properly. A lot of people tell me they eat and then they have the food go right through them, within a couple of hours. That's a thing that's all related to this. So let's look further into the research. Let me scroll down here. I hope you guys can see my screen okay. It says, it remains unclear whether insulin treatment is a surrogate for severity of hyperglycemia and overall morbidity, or whether it is a causative factor for death. Uncertainty regarding specific treatments for hyperglycemia in acute COVID. So at this point, in this study that they're writing about, they're saying, well, um, we're not really exactly sure. Is the fact that you have diabetes already a problem, or is there some underlying mechanism? During this study, though, they have found, we'll go down further because it's a long, long study. They're, saying that, we know that, having insulin resistance and obesity, those things are connected. And of course, yeah, if you have those, it's going to cause a problem. But let's go to the results section here. And they looked at almost 4,000 patients and trying to find whether or not there's a correlation here. As they say, we found a clear association between hyperglycemia and adverse outcomes. Well, yeah, we know that. If your blood sugar's high, your body can't heal the way it's supposed to, and therefore you're going to end up with a problem, right? And so in the hospital, this is where, we have a person that has come in with a high blood sugar or whatever, and the provider on staff says, yep, okay, give them insulin. But giving them insulin might not actually be the correct thing to do in this case. And so we're going to scroll down further because they have all these charts. And if anybody wants to look at these charts in more detail, I'll be happy to do that. I don't think right now is the appropriate time because we're just trying to get the basic message. And in here, they're looking to see the impact of high blood sugar on critically ill patients that have COVID. And they divided the patients in this study based on, okay, you came into the hospital with acute respiratory issues. Did you have COVID or did you not? And separated those guys out. And so what they're saying is that 86% of the people that they had admitted to the ICU had the respiratory stuff and were positive for COVID and had hyperglycemia, which is elevated blood sugar. 63% of them did not have COVID. So that's a 20% increase in if you have COVID, this is definitely going to be a problem for you. So, they go on and use lots of language here. Let's see. I think instead of going through these charts, which we can do, and I'll post the links below this video, they checked serum peptide levels. So C-peptide is a chemical that is produced when your body is also creating insulin. There's a chemical called proinsulin, and it hits the pancreas or whatever, and then there's a slicing in half of this chemical. When that slicing in half of this chemical happens, there's insulin and C-peptide. So they kind of go hand in hand. And so if you're having a high C-peptide level, that means that your body is really trying to produce insulin. And it's circulating, and for some reason your body's not responding to it. If you have a low C-peptide level, below what is considered normal limits, then that means your pancreas is not trying to produce the way that it's supposed to. So we'll scroll on further down, and they talk about a bunch of stuff. right here we see that in the setting of COVID treatment, they're giving steroids, betamethasone, dexamethasone, methylprednisolone, all of which are standard steroid treatment for respiratory dysfunction. Like if you have pneumonia or something, you're having a cough, can't breathe, etc., they're going to give you steroids. Like that's a common treatment with this. However, they separated those people out and found that there's still sort of a red flag with this. That even in the people that have been treated with steroids and comparing them to the people that haven't, they're finding a similar thing that's happening. So lots of, jargon here. And there's resistin, a macrophage peptide. They find this in people with diabetes and found this in people with the respiratory stuff and positive for COVID. Let's see. So there's a few different hormones that they found here. Specifically, they say right here, these results raise the possibility that COVID-19 causes adipocyte dysfunction, which may occur as a direct result of infecting the fat cells, adipocytes, or other cells within this, kind of chain mechanism. So we'll go on further. They say that these cells might be permissive to infection and replication, but they're not exactly sure which cell type. We found the adipocytes express the potential SARS-CoV-2 entry factors identified. They intentionally infected human fat cells in a petri dish, right? And found that both were susceptible to viral infection. So for all of the people out there saying this is a respiratory disease, this is a vascular disease, no, they're not correct when they say that. It doesn't just infect those areas, it infects everything. And importantly, collectively, these results indicate that COVID incites an inflammatory response, in part by direct infection of the fat cells to cause tissue dysfunction. And so by now, if you're still listening, you've probably thought, well, like, what does that mean? Why is that important? It's important because if you are overweight or obese, if you have a family history of being overweight or obese, you have extra cells for this virus to come in and do damage. And it may not necessarily manifest itself as a respiratory dysfunction or a cardiovascular dysfunction. It can manifest itself in high blood sugar. And this is where I would lobby that everybody needs to be thinking about this and checking their blood sugar on a regular basis to find out, where are you? Because the standard protocols that are given by the CDC and the FDA and the World Health Organization, and so on, are only saying, oh, well, every so often at this age, or if the patient, exhibits these signs or something like that, check their A1C. Everybody needs to have this done. We'll scroll on further down because, again, it's lots of jargon and sciencey stuff. Let's see here. This study is not powered to detect rare events, nor does it rule out COVID infection of pancreatic islet cells. And that's important too, because infection of pancreatic islet cells means that you could end up having a type 1 diabetes. For those of you that don't know much about diabetes, we have multiple types. There's type 1 and then type 2, and then there's subcategories of them. Type 1 is your pancreas isn't producing insulin from the cells. The cells that are responsible for producing insulin, they're done. They're burned out, they're dead, they can't do it. And therefore, you have to have insulin. And that's important. But for other people, that's also really important, because maybe it's not that your pancreatic cells aren't producing the insulin. Maybe they're actually producing a whole bunch of insulin, but for some reason your specific body is not responding to those. And that is something very important for healthcare providers to analyze and monitor you for, because over time, it's kind of like an engine or a car, and if you don't put oil in, or you don't put enough gas in, it's going to burn and burn and burn and burn and burn until there's nothing left. And so we want to try to prevent people from going into a type 2, from a type 2 diabetic state of this insulin resistance, because we're constantly producing, our body's not responding, to where, nope, we're done production, we're shut down, we don't want that to happen. So anything that we can do to prevent that is super important. Now, they do talk about limitations in this study. Retrospectively, plasma samples from consenting patients, and they say they're not matched from demographic variables, which would include age, where you live, how much money you make, what your education is, things like that. Those are demographic things. Comorbidities or in-hospital treatments. And I would actually like to reach out to them and question what they're saying with that logistic regression model. That's standard stuff. They weren't fasting before they took the samples. However, if their study was sufficient enough for them to publish this.
Sorry, we have this is.
Bye.
Sorry.
If their study was sufficient enough with the evidence that they have to actually get published in this journal, it's definitely something that we have to be thinking about. One of the things they talked about are septic shock, treatment of steroids, and things like that. So based on what they're saying is they're still trying to understand this adiponectin function, this hormone that helps glucose regulation. Nonetheless, this is important. But we have another study here, which I'm going to show now. Let me go up here. Infects adipose tissue, elicits an inflammatory response, consistent with severe COVID. So this is yet another study that's demonstrating essentially the same thing. Oh, it's not going to let me look at the full paper. So basically, they're looking at mature fat cells, and they're looking at white blood cells. In this case, they are macrophages. Those are white blood cells that come in and basically eat up any of the bad germs that get in there. They're essentially saying that so it says our work provides the first in vivo evidence of SARS infection in human fat tissue. In vitro is in the petri dish. In vivo is in the actual person. So they have also found a correlation for this. Let me stop with the research stuff and tell you why this is important. If, again, you are a person that's overweight or obese, if you have a family history of having diabetes show up in your family, maybe your grandma, your ma, your dad, grandpa, brother, sister, cousin, something else like that, you extra have to be aware that having COVID is a risk for you developing this. One of the things we have not seen yet is what is the correlation between these things and the vaccination. Specifically, the mRNA vaccines from Pfizer and Moderna that target the messenger RNA part, and the messenger RNA sends a signal to your tissue that's supposed to be stuck in your arm right here to produce the spike protein and put it everywhere so that all of your white blood cells that are involved in the fight have the ability to say, oh, spike protein, you're evil, cut you off. We don't know what the long-term consequences of that are. And we don't know exactly why COVID is causing these effects. Is it the spike protein itself? Is it other factors? We don't know. The data is not there yet. Trust it's coming. But if now was not the time, I don't know a better time. This is why it's really important for you to lose weight if you have extra weight on. This is really important for you to be ensuring that your blood sugar response is good. How do you do that? Step 1, go to Walmart, get yourself a meter, or go to Walgreens, CVS, Kroger, whatever place. They have meters that you can purchase. You do not need a prescription to do this. You can purchase them. The Walmart meters like $10, and then for like 100 strips, it's $20. Okay, so $30. You're out $30, right? But you can then be checking your blood sugar, monitoring it through the day, seeing how you respond to foods, how your blood sugar operates over the day. And sometimes your blood sugar can be high and you didn't eat anything at all. And so it's very important for you to understand how that pattern works in yourself. And then you can say, hey, Dr. Smith, or whoever it might be that you see, I seem to have high blood sugar. I don't know what's going on. Can you run further testing? And this would also be an indication for you to be checking the blood sugar after you eat stuff to see what happens. Because I talk to people all day long. I have some people that can eat an apple and peanut butter, no problem. I have some people, if they look at an apple, whoosh, blood sugar goes up. It skyrockets. And no healthcare provider yet has been able to say, Why? One of the things we do know from COVID is that people who have long haul COVID symptoms, or syndrome, I should say, exhibit a very strange new onset of food sensitivities, where a thing they could totally eat without a problem before now causes them trouble. That trouble can be manifest in high blood sugar. It can be manifest in joint pain, migraine headaches, feeling of anxiety, ringing in the ears, digestive issues with, diarrhea, or feeling of fullness after they eat just a small amount. It can also manifest itself in neurological symptoms, like weird sensations in their fingertips and feet, tingling or numbness kind of feeling, or cramping of the muscles and things like that. So it's very important for everybody to start paying attention to what your body is doing and how it feels, and documenting that information to take to your healthcare provider. I've heard stories of people who are in the peak of health, mountain bikers and hikers and all that kind of stuff, either ending up with COVID or having one of the mRNA vaccinations, either by trial or just by doing it early. And after either of those things, now have these debilitating issues. I've also heard stories of people that have had COVID and or vaccination, not a problem. But you won't know, you won't be able to go back to your healthcare provider if you end up with concerning symptoms unless you map the stuff out. So I really strongly encourage everybody to start keeping a health journal. I'm in the process of actually creating a health journal for people to be able to track their stuff. Everybody should be checking their blood pressure, heart rate, breathing rate, blood sugar level, what you ate, if you took meds, when did you take them. Write that stuff down. Because if you walk into your doctor's office and you're like, well, hey, doc, I've had a headache. Oh, how long's that been? Oh, I don't know, 2 weeks. And what else? Well, my belly's been kind of funny. How? I don't know, just pooping more than normal. And that's very obscure information. And the providers that are out there doing their thing, God bless them all, they don't have time to sit there and listen to you hem and haw about, well, I think I might have felt fine on Tuesday, but then I didn't feel good on Thursday. Have it written down. If you want appropriate treatment, you have to be able to document what's going on with you and put that in a condensed version for your provider to see, so they can see the pattern that's going on with you. Because otherwise, they don't know. They're listening to what you say, and well, they said this and they said this, and okay, I did this lab and it shows, okay, well, I'm gonna guess. It's like playing darts. You don't want to play darts with your health. I know I certainly don't. And I did for a long time. And it wasn't until I got really smart about this stuff that I figured out what was going on with me. Which, for me, I have long haul COVID stuff. But fortunately, I've paid attention to the research and my own self and figured some stuff out, and it is getting better. And it can get better for you too. And this is another reason why this stuff is very important, because we keep seeing in this research, as you see right here, highly inflammatory subpopulation of macrophages, blah, blah, present at baseline. So if you have already an inflammatory condition, and let's say you didn't have diabetes before, but you have, some kind of inflammatory condition. You go to the doctor and, oh my God, your A1C is, super high. Take these diabetes medications. Perhaps instead of just throwing you on these, blood sugar control medications, maybe they need to be looking at what is causing your inflammation, treat the inflammation part, do the root cause kind of thing, and then the diabetes-y thing will stop. Lots to unpack with this still. I still need to continue doing the research and reviewing things and things like that, but I wanted to present the findings to you all today as something to think about for your own self. Because at the end of the day, doctors just guessing. They really are. And it's not to say that they're not smart and that they don't know what they're doing, but it is impossible for them at this point to have all of the information unless they're checking for very specific things. And therefore, it is up to ourselves as individuals to put on that detective hat and become our own private investigator for our own health, start documenting the things, paying attention to how we feel, paying attention to the patterns, and coming into the providers and saying, guess what? I have the following documented. These are the things that happened. Something isn't right. I need you to look further. And if your doctor tells you, I don't have time for that, I'm not going to do that, bye, Felicia. You need to find another provider. Because the one that tells you they don't have time for that, they're not going to do that, they're not doing their due diligence. And a lot of people will argue and say, well, but my insurance won't. Insurance doesn't get to tell the doctor what to do. Insurance says, we're not going to pay for this, we're not going to pay for that. Payment can be found somewhere. The important thing is that the stuff is documented and it's reported. And also, I would like to add to the end of this, if you have had COVID and you have some of these long haul symptoms, brain fog, nerve problems, digestive problems, sense of inflammation in your joints and things like that, you got to report those to your doctor. If you've had the vaccine and you notice an increase in problems related to inflammation, if you notice that you suddenly can't control your blood sugar and it was previously well controlled, or you have new onset joint pain or worsening of joint pain that was there, things like that, all of that stuff has to be reported to your healthcare provider. If you're not talking to them, then they can't know that there's a problem that needs to be addressed. And this is all for the greater good of everybody. If you are overweight or obese, all the more motivation to try to do what you can to get that extra weight off. And that might mean that you have to modify your nutrition. That might mean that you have to choose differently. So let's say you're like a pasta bread bowl person. You love that stuff. You're going to have to find a different way to do that. You're going to have to start documenting how you feel after you eat things. You're going to have to start checking your blood sugar. Got to get exercise and fresh air. And for me, in the work that I do with people, I operate on a foundation of what I like to call the 3 M's of holistic health: mindset, movement, and meals. What are we thinking? How are we moving? What are we putting in here? Those are the 3 pillars that can make or break your health. So on that note, I'm going to let you guys go. If you have further questions, post them in the comments down below in chat, or send me a private message. And you can find me on Facebook. You can find me on YouTube. You can also find me, let's see. You can find me at the Open Path Healing Arts Collective. I'll post links to all this stuff, but if anything I say resonates with you, if you have questions, whatever, I'm happy to answer them. And I will continue doing these sessions as further research comes out. But on that note, I hope everybody has a fantastic day. And yours in health, Coach JJ out.